Hi, I'm Diana. Today's topic is CPR on an adult. What's very important when we are doing CPR for an adult is that we find the right location, we go to the right rate, and we continue for as long as possible. So what's very important is that we find the center of the chest. By this, you can follow the nipple line to the center of the chest. If that is not visible, follow the armpit line to the center of the chest. When you are to perform compressions, you will use the heel of your dominant hand. This will go in the center of the chest, while your other hand interlaces into your dominant hand. When we find the center of the chest, we have to make sure that our elbows are straight and we are over the body. When we do a compression, when we go down, it'll be about 2 inches of depth. We go down to the 2 inches and allow the chest to recoil. What this allows is the heart to refill with blood so we can pump that blood and oxygen back into the brain. When we are doing compressions, it will be at the rate of 100 to 120 beats per minute. This will show you that you are pumping at an accurate rate because you are the artificial heart and lungs of this person.